So now we're going to go ahead and start Module 2 on the causes of externalizing disorders. So just a reminder, these are the outwardly directed disorders that we commonly see in childhood. So we highlighted 3 different types of disorders: ADHD, oppositional defiant disorder, and conduct disorder. So for this particular module, we're going to look at some of the individual causes and some of the frequencies of how often these disorders occur. And as you can see here, the frequency of an externalizing disorder that adolescents will have at some point in their life is almost 19.1%. So what we see here is roughly 1 out of every 5 individuals. It seems a little high to me, but that's what your book reports. A lot of that is going to be taken up with ADHD. So the Centers for Disease Control, or the CDC, said that 9.5% of children in the United States had a lifetime diagnosis of ADHD. So we see this frequently, and I'm sure it doesn't take a whole lot of thinking on your part to remember people as you were growing up that probably had one of these types of externalizing disorders. Once you start looking, it's kind of like you can't not see it. It's that prevalent. So about 2 to 10 times as many boys as girls have externalizing problems. So when we think of externalizing disorders, we tend to think of it running more with boys. Internalizing disorders tends to be a little bit higher with girls. Now, once again, gross stereotypes here, but in general, those are kind of the patterns. Now, Rudder, back in 1989, observed that there are family risk factors that maybe increase the odds of a child developing an externalizing disorder. And you can see some of those factors right there. Being low income or in poverty certainly increases it. Having overcrowding in the home, unfortunately, I think many of us are experiencing this. Having maternal depression or paternal antisocial behavior. So this gets into kind of some genetics and environmental influence there. Conflict between parents, so that shows some modeling and also adds to some of the chaos that might be in the home. And then being removed from the home due to any of the factors of above or other issues like abuse. Now, your risk of developing an externalizing disorder increases 4 times if you have 2 factors in that family risk factors, and it increases even more if you have 3 of those risk factors. So environment matters is what the kind of take home from that is. Now, other more specific causes of externalizing problems, one of them starts at the very beginning, and that is the temperament. Now, when we talk about an individual's temperament, these are going to be inborn behavioral characteristics that include things like activity level, emotionality, and sociability. So Thomas and Chess, back in 1977, created these 3 groupings of temperament that they commonly saw in children. This is not the only way to classify this, but it is one of the better known. So an easy temperament are children that are friendly and obey most of the rules. A difficult temperament child is unpredictable and often challenges, and slow to warm up is usually more shy and withdrawn. And what they found over time is that children with difficult temperaments during infancy and toddlerhood tends to predict the development of later externalizing disorders. Now, this isn't a one-to-one correspondence, so you could have a difficult temperament and not develop externalizing disorders, but it certainly increases the likelihood that you will. We also see some neuropsychological abnormalities in more what we call kind of soft signs, and that would include things like delays in fine motor coordination, fine motor being your more external, like finger grips and things, not your gross motor. And then as far as genetics are concerned, there is an extremely strong influence for ADHD being genetically related. They think it explains up to 90% of the variance in symptoms. Anytime you have anything over 40%, we consider that a very strong influence. So to be 90% means that you inherit a lot of this ADHD from one of your parents or both. Now, as far as gene and environment interaction, what we see here is that there is some of this gene environment involved with oppositional defiance disorder. So, part of oppositional defiance is certainly inherited, and that inherited kind of characteristic is a tendency to react more negatively to adverse environments. Throw them into an adverse environment, and you're more likely to see these kind of oppositional defiant behaviors. So those are some of the biological factors. Now we're going to go ahead and switch to more social factors. And the socialization is really the process of shaping children's behavior and attitudes to conform to the expectations of parents, teachers, and society in general. So anytime a child is born, they have no idea about what the social norms are or what is expected of them. And so, therefore, society and their parents have to shape that behavior. And generally, children will want to obey those parents. The odds are much better that they'll obey if those parents have warm, what we call authoritative style of parenting. And when they have that, it's going to be where they have fairly high expectations, but then they also have pretty good responsiveness to the child's needs. If you have any other type of parenting style, it's not associated with as good of outcomes and may increase externalizing disorders. Gerald Patterson, who did a lot of work with individuals, children that have oppositional defiant disorder, conduct disorder, said that coercion has a very big role to play in regards to externalizing behaviors. And what coercion is where parent and children are kind of locked into this mutually reinforcing cycle. So parents are positively reinforced for children's misbehavior by giving in to children's demands. Okay, in other words, if I go ahead and give in, then a child will stop some negative behavior that I don't want. And the child, in turn, is going to be positively reinforced for their negative behavior because they are going to be getting what they want. So a child is adding something, that's that positive kind of reinforcement behavior, and then the parents are negatively reinforced for giving in. When that happens, you have coercion, and it's much more likely the behavior is going to get more out of control because of this kind of pattern that people are in. So this has real practical implications, this idea of coercion, because we need to break that pattern. And as therapists, what you're doing is trying to teach parents to break the pattern by ignoring the misbehavior, punishing it, or rewarding when the child does more positive behaviors, the ones that you would rather see. What we also have social factor wise is the issue of negative attention. So in some children, if they can't get positive attention, they would rather have negative attention than be ignored altogether. And so the punishment is actually reinforcing the misbehavior because you are drawing attention to it. This is why ignoring for little things is a more adaptive way for parents and teachers to do. A lot of times, children that are the class clowns, so you see a photo of a child being kind of a class clown, that is a result of this kind of negative attention. And the best way is to try to ignore it as much as possible. Of course, some children don't like that, and so they will up their game to the point where you do have to pay attention. But basically, this negative attention, another way to counteract it is, of course, give positive attention, recognizing the child when they aren't disrupting class and doing what they should. But that can be a little more difficult because you got to really be on the lookout for it if you're a parent or a teacher. Here is a breakdown of some of the styles of parenting that I was referring to on the last slide there. The authoritative, that blue one, you can see high demanding, high acceptance responsiveness. That's the best outcomes. Authoritarian tends to be less of a positive outcome, but better than the indulgent or neglectful. And you can see this grid. And if you take any development classes in the future, you're going to see this style of parenting cropping up. It's pretty famous and well known. Going on with more social factors, another thing that can have an impact is inconsistency. This can involve very frequent changes in the style or standards of one parent or two parents that are inconsistent across regarding the rules or expectations. So, for all of you who become future parents, one of the things you need to be sure of is to be in sync with your partner about the rules and such. Even if you do have some disagreements, you never show it in front of the child. You want to give them that level of consistency. When you don't have that consistency, you're going to have an increased likelihood of externalizing problems developing. Our final set of social factors is peers, neighborhoods, and media. So children are like sponges. They're taking in the standards of the society that they are in. So we know that peers and neighborhoods can have different levels of what's considered acceptable behavior. And if you are in an environment that encourages more delinquent and antisocial behavior, children and adolescents are more likely to engage in that. And it's what we call a kind of a socialized delinquency. This is where socialized delinquency is when there's criminal acts that are occurring, but it's in the company of others. And it stands apart from individuals who do some of these kind of criminal acts by themselves. Those are much more intractable issues. Many times, those who are more socialized delinquents can be positively changed by changing their surrounding environments. And then, of course, we have the ever-present concern about media violence and computer games and media in general, and some of the behaviors that are displayed there, knowing that that can cause maybe more aggressive behavior, going all the way back to Bandura and his Bobo doll experiment, where viewing violent actions on film or TV spurred on more aggressive actions in the child later. And they've applied this to all sorts of media. So that contributes. I certainly don't think there's a way to figure out if one causes the other. We know that there is some correlation, but we need to be cautious because the child could be just as much attracted to the violent behavior because they're violent themselves versus the violent media causing the violent behavior. So we always have to be fairly careful when we talk about that. Okay, now we're going to look at some psychological factors. And for a long time, they thought that those that had externalizing disorders actually had very low self-esteem. But what they see is that when children are asked to say that have ADHD, they will say that they actually are really good at a lot of different things, and actually they overestimate their competence. And that is due to what we call a positive illusionary bias or illusory bias. And what this means is that you, as a way to protect yourself from what is obviously kind of a more hostile or critical evaluation of your skills, you rather kind of have an illusory belief that you're actually much better than you are. And so it's really an effort to try to protect kind of the ego, even though it may not be all that successful. We also see some other psychological factors like a lack of self-control. This is your kind of internal regulation of behavior. It's often linked to externalizing behaviors. And of course, it's another way of looking at the issue of impulsivity, which we talked about in Module 1. And then finally, delay of gratification, which is your ability to defer smaller but immediate rewards for larger, longer-term benefits. And delay of gratification, the famous experiment is the marshmallow experiment, where kids were tested to see how able they were to resist eating a marshmallow now with the promise of having more, two or more marshmallows if they waited. And those who were able to wait, as they measured their outcomes on a variety of other things, found they tended to have more success. We're talking about individuals with externalizing disorders that have great difficulty in their delay of gratification. A couple other issues before we wrap up this module. If you do happen to have an aggressive child, which is a type of externalizing disorder, you oftentimes will see that they overinterpret peers' aggressive attentions. So in other words, they have a bias, kind of an aggressive bias, and the way they take in information, if there's any neutrality or uncertainty in a situation, their bias is to anticipate more aggressive kind of techniques. And so they will go ahead and do that kind of interpretation. And so then they end up acting more aggressive than you would typically see. Okay, so that is the end of Module 2. Module 3, we're going to start talking about what do we do with children and adolescents who have externalizing disorders in the form of treatment, and we'll see both medications and therapy having their role here.